And to the point, the health situation in the country is what we're looking at, of course, narrowing it down to the bone of contention that lies between the Ministry of Health and the Kenya Union of Clinical Officers, and basically the numerous concerns that we continue to have as a people in relation to health. Yesterday marked 5 months since the rolling in of Social Health Authority, of course, she from the defunct NHIF, and Kenyans are asking, is this the way to go? Is there a way we can reverse the whole process? Specialists are saying that the government has opted to get into this without listening to what it is that, of course, specialists have to say, and therefore the reason why we get to hear this or to experience the numerous hiccups that are there. But like we said, I mean, there are a couple of people who have tried using the share services, and they say it has worked just perfect for them. Should we continue? Should we not? The latest casualties, we would say, at the Kenya Union of Clinical Officers, and the chairperson, Peterson Wachira, is here with us this evening to, just tell us what then is the progress amidst the talks. How far, if any?
Thank you, Linda, and thank you for always giving us this opportunity,
right,
so that Kenyans can understand where we are in terms of the health sector in this country. I must say that we are not at a good place because we have not moved. Since we went on strike,
right,
we have not moved, probably half a step. Because the things that took us on a strike are majorly, I can say, there are 4.
Right.
Though we have coalesced them.
It's quite a huge list, but coalesced them to, okay.
Yeah. Broadly, we had put 2 issues.
Right.
One of them being the exclusion and discrimination by the Social Health Authority. That in itself has several things.
Right.
It has the facilities, and I wish Lishenga was here, because some of his members are actually aggrieved in that grievance. And of course, there is also the pre-authorization by the clinical officers that is after empanelment.
Yeah.
And I'll be able to explain that later. And then we have the other issue now carries a bulk of the things. That is the non-implementation of the return to work agreement of last year. Right. That is 2024. It has CBA. It has the issues of promotions and redesignations in line with the career guidelines for clinical officers. It has the issues of the UHC, it has the issues of recruitments, it has the issues of medical cover, the salaries that had been stopped during the strike, and even the issue of Kirinyaga, our officers who had been sacked in 2019 by Governor Waiguru. Then later they were reinstated by the Public Service Commission in 2021, further enforced by the court in 2024, but then Kirinyaga County has still refused to honor those orders. And lastly, we have more than 2,500 interns who have not been posted by the ministry for the past almost 2 years, and they have been at home. So it is these issues that really make us be on strike. But if I can explain about SHA.
Before you even get to SHA, does it not disturb you that you continue to raise concerns for quite a long time, and you would consider yourselves, and when I say yourselves, I mean including the General Secretary, you yourself, for years, the same concerns and many others continue to crop up. They have not been addressed. Do you suppose then that you lead this cadre of the health sector as should be?
We do.
So what is this that stops you as a leadership from attaining some of the concerns that the union members then would wish to see attained?
You see, the issue of collective bargaining is an issue that is between employees through their union and employers. Mostly in this context, we are talking about the employers in the government sector, being the Ministry of Health and the Council of Governors. Except the KMPDU that got their CBA in 2017, there is no other union in the health sector. We have around 6 unions in the health sector. There is no other with the CBA that is signed. Much of it is MOUs and return to work agreements.